Welcome back to my channel, the Two Talk Studio. I am Dr. Veena, General Dental Surgeon at ASHIRVAD Dental Clinic, KUDUR, Bangalore South District. Today, I'll be discussing in detail about oral medicine and radiology. Think of us as the detectives of the dental world. We don't just fill teeth or extract them. We find out why the disease is in the first place. Oral medicine and radiology is the backbone of clinical dentistry. It bridges the gap between general medicine and dentistry, focusing on the diagnosis, medical management, and radiographic interpretation of the orofacial diseases. Let's spend a few minutes mastering the art of diagnosis. First, history taking and extraoral examination. Let's start with the bread and butter of oral medicine. History taking. Every great diagnosis begins with listening what the patient has a complaint about. We start with asking the name of the patient, the age of the patient, the place where are they from, their occupation. Then we ask the chief complaint, which is what was the reason that they have entered the dental clinic, how long they have the pain or any trauma that they have endured, are they on any medications, or do they have any chronic long standing illness, and recently have they taken any medications for the dental pain. During the extraoral examination, we check the lymph nodes, palate, and the TMJ. We look for the facial asymmetry. Navigating oral lesions. Now let's have a look on the inside of the patient's mouth. Intraoral examinations require systematic observation. When we spot an oral mucosal lesion, we categorize them into ulcerative lesions. These are breaks in the oral mucosa. If we see an ulcer, we ask the patient how long it has been there. Is there a paining sensation? Is there a burning sensation? Is it after they had a certain kind of food? Or is it traumatic? Then we check for a sharp tooth or their cheek biting. And is that ulcer a recurrent ulcer? Which means that does this ulcer happen often on a very few days? We usually look at the borders. Then there is something which is called as white lesions in a general terminology. These range from benign condition like candidiasis on the tongue, on the cheek, or on the buccal mucosa, as we call it, to a pre-malignant lesion called as leukoplakia or lichen planus. Then there is something which is called as a red lesion, which is more dangerous than the white lesion as it has a high potential for malignancy, which means that it has a high potential of turning into a cancerous lesion. If the lesion has been present for more than 2 weeks without any local cause, biopsy is the gold standard for definitive diagnosis. That is, we need a biopsy to see whether the condition is a precancerous lesion or it has a potential for turning into malignant lesion. Then comes radiology. The third eye of dentistry is radiology. Clinical examination gives the surface story, which means that only the above portion and the surrounding which is visible to the naked eye is diagnosed. But radiology shows us what's beneath the surface, what surrounds the surrounding bones of the patient's mouth. We use a systematic approach. There is something called as radiolucent and radio-opaque structures. Radiolucent are black areas in the X-ray and radio-opaque are white areas in the X-rays, which means radiolucent is air spaces and pulp tissues and cyst, whereas radio-opaque is enamel, the first layer of the tooth, the dentine, the second layer of the tooth, and the dense bone, the bone that holds all these teeth together. The most common dental X-ray that we use on a regular basis is an IOPA, that is the intraoral periapical radiograph, which gives a close-up of a single tooth or few teeth in detail, namely, namely it is used for finding hidden cavities like cavities between two teeth or a cavity below the filling that has already been done, which is not visible to the naked eye. Diagnosing infections like pus formations on the root tips or any other pathology. Then, root canal, checking the length of roots and monitoring the success of the treatment procedure. And it is also used to assess gum health, like identifying bone loss or any gum disease around specific teeth. This is the second most common dental X-ray we use in our daily practice, called as the OPG, that is the orthopentamogram. First, it is used to evaluate improperly erupted wisdom tooth, like in this case, this one, this tooth, and this tooth. Then it is used to evaluate orthodontic corrections, like how the teeth are placed before placing the braces. Then it is also used to evaluate any missing tooth or any unerupted tooth before the braces are placed. To evaluate bone loss before any gum surgeries. This is an OPG of a 9-year-old patient of my clinic. We use this OPG to evaluate how the patient's permanent tooth is going to erupt. So this X-ray has the milk tooth and the permanent tooth that are going to get erupted in near future. The third X-ray, which is the CBCT, that is the cone beam computed tomography. It provides a cross-sectional view, allowing us to view structures in a 3D format. Why is it essential? Endodontics. It helps us spot hidden root canals and periapical lesions, which means the lesions that are present below the surface of the tooth, which are not visible to the naked eye on clinical evaluation. Implant planning. It helps us accurately measure the bone width, height, and locate the inferior alveolar canal, that is the canal on the lower jaw. The third one, TMJ analysis. It helps us to view the condyle and the lower jaw clear. The medications that we give to our patients who comes with toothache or any abscess or pus formation or severe infection, we generally give antibiotics, analgesics, antacids, multivitamins for this patient, ranging from 3 to 5 days depending on the severity of their pain. Then for precancerous lesions and conditions, we ask the patient to quit the habit and put them on a multivitamin therapy and regularly monitor the progress of the therapy. If you enjoyed this branch of dentistry, do like and subscribe to my channel, The Tooth Talk Studio, and thank you so much for watching.